And we're continuing our conversations here at the Tallinn's Creative Harbor, or Creative Hub, where the e-conference, e-health conference takes place. And my guests are Estonian Minister of Health and Labor, Mr. Jevgeni Ossinovski, and European Commissioner for the Health Issues, Mr. Andriukaitis. Let's start with you, Mr. Ossinovski. Estonia has been kind of the country that shows itself as a beacon here at the conference. We already have implemented many services in this field, but we hear constantly that Estonia should be bolder in its example and kind of forcing during our presidency to act for other member states more. So what should we do before our presidency ends in December in the field of e-health?
Yeah, indeed. Digital agenda has been a high priority for the Estonian presidency, an overarching priority horizontally through different sectors. And of course, that also concerns health, and that's why e-health is one of the top priorities for my ministry during the presidency. So apart from this conference now here with different stakeholders around the table, we had the informal ministers' discussion on that in July, also here in the Creative Hub, and we are planning to arrive at council conclusions on e-health at the December council to basically show the way forward on those issues for both the member states, those willing to move quicker, but also for the European Union as a whole. Because we realize that there are a lot of developments in different nation states, in different regions of nation states, in different parts of the health ecosystem, one could say. But there is very little strong EU-wide or also nationwide progress. Here in Estonia, what we have been very good at is securing a very strong and foundation for e-health. So we have a basic infrastructure in terms of data, health data, their privacy settings and so on in place. What we haven't been as good at yet is how to implement it better for the patients, to provide more personalized and more effective care, which is the whole point of e-health. E-health is a tool to actually provide better care. Now, many other countries have been very successful at specific smaller applications, more successful than we have been, but they don't, again, have this basic foundational infrastructure for that. So it's really in the EU, there's a lot to learn for different countries. We have to learn how to better apply data that we have, which is really, really good, the data itself. And other countries, I think, can look at our example of how to build up a nationwide system for collecting data, analyzing data, and then putting it to better use.
As you said, the health services, and you, Mr. Andriukaitis, have underlined that also are in the competency of member states, not the European Union competency and Commission's competency. You are trying to build the kind of foundation for the health topics in Brussels. So how that goes, and how much Commission takes responsibility for the health of Europeans?
As you know, first of all, we will see possibilities how member states shows willingness to cooperate.
Among themselves?
Yes, because as you know, it is enshrined in treaty. They can use so-called enhanced cooperation tool, which is very powerful one. Of course, also very important to say that just we have in our hands cross-border patients' rights directive, which allow us to monitor situation, how such a directive was translated into national systems of all member states, and how member states do their homework, establishing national contact points, creating IT tools which allow us to guarantee cross-border information flow, and also very important, European reference networks. We just built those networks in March this year. 25 member states established 24 European reference networks. They joined together more than 300 hospitals and more than 900 units. It's a good example to show willingness to cooperate in those networks now. But of course, we need to have, as Minister mentioned, we need to have a European health records platform, because we need to have standardized European patients' records and standardized e-prescription issues. Otherwise, it will be very difficult to see such system working in proper way. And Commission homework is today to present IT tools and IT platforms that member states can from their side, they can build their own the IT systems. From our side, we will see possibilities to build interconnections between those systems, and of course, and help member states to connect systems and to monitor situation.
So the goal is to have a single healthcare marketplace from Portugal to Estonia in the east. So when prescription is written in Tallinn, you can fill it in Madrid. How far we are actually from this reality? Is it decades?
Yes, now we have a roadmap. It means that at the end of 2018, we will see first step 16 countries express their willingness to cooperate. 16. And now they are using Connecting Europe Facility financial instrument. They are doing their homework, and Commission do their own. And it means at the end of 2018, we will start to manage the situation, because final line is 2020. Till 2020, we will see the possibilities to join minimum 26 member states and to have operational system. Of course, we know that we have a lot of homework, starting with standardization issues, with e-prescriptions, patient records, semantic systems, the possibility to understand each other. A lot of issues are on the table, but the work is ongoing. And today, now, it is very important to look at Estonians' achievements at council level, because in Estonians' hands today, council conclusions. And they count on Estonia to really show bold proposal and encourage member states to accept. Of course, it's difficult. Of course, it's a big compromise to see how to move forward. But we see how to assist Estonia, because Commission is only owner or broker in this case. But we are together.
But Estonia will show example already next May, when Estonians can fill their prescriptions in Finland and Finns in Estonia. That's the cross-border cooperation. But as Estonian former president, Mr. Ilves, said yesterday, he was leading a European Union task force on e-health. It took 5 years to implement this cross-border cooperation. 5 years ago, the technology was there, but there were so many hurdles, including legal hurdles, to overcome. So it took 5 years to this seemingly easy step that those two countries, two neighbors, can cooperate.
Yeah, it's seemingly easy. It's actually quite difficult, technically also difficult. E-prescription, of course, is one of the easiest one. That's why this is where we start. If we talk about more general exchange of patient records, then of course it's a matter of data privacy, different rules of patient records holding in different member states, and that's why we're happy that we're getting more uniform regulation on that on the European level. That's a clear prerequisite for e-health, that we have a solid, strong data privacy regulations on the European level that is now being accomplished. But also what the Commissioner said, the semantics. It sounds technical, and it is very technical, but it's incredibly crucial in order to actually do that, so that the systems would actually automatically speak to each other, that there would be interoperability, the same standards of data collection and exchange. And it's clearly not easy, and that's, I mean, this is the European Union. We have 28 sovereign member states with their own legislation systems, with their own traditions, with their own constitutions, and with their own democratic processes.
Soon 27.
Soon 27, but it doesn't make it much easier in this regard. So it's of course it's a difficult political task to move forward, and of course technology would allow us already to do much more than we are able to do now.
Okay, of course, but I will just mention one thing: data protection, because people concerns are very high about data protection, data security. And we have in our hands data protection regulation now, because it was finished in May. It's a very excellent legal framework. Second issue is cyber security issues. And we have also in our hands a lot of instruments moving in such direction, not copycat generally about cybersecurity, but cybersecurity in health area also. And of course, third, we have in our hands patients, cross-border health care patients' rights. It means patient safety issues. And last but not least, people's support is very high. We just finished our public consultations. More than 80% of people are supporting such initiative to do more. It means that health issues must be high on European Union agenda and on member states agenda. If we have on our side people support, it means that we have good opportunity to move forward.
As we heard from Sweden today, it's kind of two-speed road. One is the countries inside what they're doing. Like Sweden has a goal to become the best healthcare provider in the world at 2025. And then the connections between the states in the European Union. So what are the Estonian aims as a country? Let's see the same date, 2025, where Estonia wants to be in e-health, and how connected should Europe be by that time?
We clearly, firstly, we are already European champions on e-health, and of course
But we are not arrived. As you mentioned.
Of course not. I think that
nobody is arrived.
You never arrive anywhere with that, because technology is developing so quickly and new possibilities are opening up. Our main strength is this very robust infrastructure that is in place. We have a nationwide patient record database that is completely safe and is obligatory for all healthcare providers, which means that with each day we accumulate more and more and more data. Now that, of course, firstly makes it easier for patients to move between hospitals and in the future also between countries to get healthcare more easily, and that helps practitioners to actually see the history online in one database. But it also helps the system to actually use this big data that is being collected there, firstly for research and analytics, but later to actually improve the real services for people. And one of the most ambitious projects that we have is linking genomics data to health records. We already have that in Tartu, in the Genomics Fund. We have 50,000 gene probes now here. We aim in the next 5 years to get to 500,000, which is one of the biggest number in the whole world. And what is our big plus compared to many other biobanks in other places is that we can link it with those exact patients, exact health records, and actually see how this genetic data can be useful in real practice to provide better care, but also better prevention, what is very dear to both mine and Commissioner's heart, to actually be able, in the system design, be able to provide better prevention of care. For example, we'll be already piloting by the end of next year. We'll be piloting this the same project in regard to breast cancer. That's those patients who have a genetic risk for breast cancer, that we would be able to know that right away before there is actually any real problem. We can tell that to patients, and we can put them on monitoring so that there would be much easier to actually prevent those both, of course, health problems for those people, but also more efficiently use the public resources in this regard. And this is just the beginning, this one breast cancer case, but there are variety of possibilities, both in pharmacogenetics, but also in terms of different diseases.
And European level?
Yes, if I may, I sent today once again signal about possibilities to encourage member states to cooperate, not waiting, but to cooperate at a regional level. For example, Estonia, Latvia, Lithuania, Finland, Sweden. To present a pilot project of regional cooperation, not waiting when all we will start, but and of course using, for example, reference networks in some areas, starting to do something, because in reference networks you have all. You have directive on place, you have data protection, you have a lot of data within countries, and you have possibilities to treat people, because in some countries you have 5,000, 6,000 people only. You have no chance to treat them alone. You need to immediately react. It's a good opportunity to move forward. Of course, also, as you mentioned rightly, about possibilities to create so-called big data or big information clouds. Without possibilities to cooperate, no one country has opportunity to move forward in such direction. We need to encourage cooperation. And of course, we need to use not only Connecting Europe facility, but we need to use Horizon 2020 issues and money, and encourage researchers, industry, health practitioners, academia, to also to join, to create hubs, consortiums, and around, for example, European reference networks, and to present new options and possibilities. We need to trigger those processes because people are waiting. People's support is very high in very concrete situations. As you mentioned, breast cancer, and of course, different types of genetic diseases, rare diseases, and so on. If you have children, can you wait 10 years? No, you have no chance. You have see possibilities to treat your children now. And of course, it would be good to see how to invite patients, patient organizations to be on board and to activate those processes. From EU side, we are ready to assist regional cooperation and help from our side to trigger those processes.
And the regional cooperation already exists very well because we have this Estonian-Finnish cooperation, but I hear from Estonian entrepreneurs that the Estonian-Lithuanian cooperation in e-health is very, very good, and Lithuania has achieved many results. We have many questions, not many, but some questions from the web. People have been sending them to Commissioner's site and the Estonian Presidency site. And there are very concrete questions. How to help women with breast cancer, you mentioned that, with e-health solutions, how to vaccinate people for measles and help. So these all solutions could be on internet, as you mentioned. It's just a willingness and time when it's available.
We have now on our internet, now we have website dedicated to breast cancer issues. Please look at the Commission website immediately and to see our advices, what can you do, how can you use screening possibilities in your country, and how to you see possibilities to also to ask your national contact point to communicate with different reference centers, because such information is now here. I will be more than happy to draw attention on possibilities to use our information.
As we discussed at the conference, there are lots of proposals from companies what kind of solutions they could provide. How governments and the European Union decides what to support, what not to support, because the marketplace is very colorful for apps on e-field.
Maybe it's a question also about...
Here's this public and business
about today's
cooperation.
discussions about innovations, how to assess and how to describe innovations. In this kind, we are on a way to finalize our legal proposal on health technology assessment, which can help member states to use such health technology assessment tools, assessing innovations, discussing with industry, and of course, providing information, and of course, asking their assessing bodies to use common methodology to assess technology. Because today we have a lot of startups, a lot of proposals, but nobody knows, how to really address issues related to it's innovative or not. This is not theoretical question. It's practical one because it relates to costs, to reimbursement issues, to money, to public money. Health technology assessment is really, the instrument which can help us to guarantee cooperation with industry in very more sensible way.
And on the country level?
First of all, I think there is a lot of private innovation happening that we can see each day with our devices with different wearables that actually produce either health data, concretely health data, or health relevant data. And I think it is already in the process of raising awareness of people of how to better take care of themselves, how to prevent many of the diseases. I think the next step is how to integrate a lot of this data that is already being accumulated all the time into to feed into the real health systems, whether be it with hospitals or with actual state systems. Of course, that is still a bit of a new thing that hasn't been fully sorted out anywhere. But I think that is one of the new sort of avenues of development. If we can do that, then there will be much more sort of real life looking after the health conditions of people. And again, technologically, it's already possible. The question is how can we integrate that into the systems. And second of all is of course how to motivate healthcare providers, the different levels of healthcare providers, be it GPs or specialist care, to actually take on board all those innovative solutions that the private sector is already have developed to use for the benefit of the patients. And this goes to the, of course, healthcare system governance questions. How you actually motivate hospitals, for example, to be better at offering care. And many countries have achieved here relatively good results, but we still have systems where we just pay for hospitals for just providing some units of care for serving this and this many patients. They are not really looking at what is the quality of care, whether they have done everything to prevent actually people from going to hospitals. And there are some schemes in different countries where, for example, some healthcare institutions are basically paid for those visits that did not happen. If they're able to actually use, for example, e-health technology to prevent some diseases as their action, then of course it's a saving for the government, but also it's of course better for the people. And how to integrate right incentives into the healthcare governance so that they would be interested in competing on who can offer more innovative care would be very, very important for especially European countries where the majority of healthcare is dominated by public institutions, and we know that in public institutions the motivations to be even better all the time may not always be there automatically, so you have to come up with systems that support that. And here in Estonia, this is one of the discussions that we're starting here, how to fund hospitals in a way that we would actually pay for results, pay for performance, pay for health outcomes rather than patients served. And it's of course technically difficult to do, but some countries have been already able to move here, and I think that's really important.
But countries have to cooperate also in other fields that are maybe not directly related to the healthcare. Let's say the alcohol. That's one of the topics you've been advocating, limiting the sales or raising the taxes. Estonia, I just read, this was last week in our discussions here in Estonia, that the country's budget has estimated certain sum from alcohol sales, but Latvia has lowered the prices are lower, and the money is not coming from there. Finland has higher prices, Finns are coming to buy here. But in the end, it influences the health, the expenditures to health. So when we talk about e-health and the healthcare in the future, we have to look at much wider.
Of course, we know that all very well, that the biggest part of the health outcomes comes from outside the health sector. In the health sector, we mostly deal with the consequences. Most of prevention happens in the social sphere, actually. And that's why, of course, three big issues in terms of prevention: alcohol, tobacco, and food, diet. Overweight linked to that are incredibly big problems, both on the national level but also pan-European level. And of course, it's clear that on these issues the business interest is mostly and quite legitimately has opposing interests to the public interest of both governments and the European Union. And of course, these discussions are not easy. And the solutions to the questions, be it labeling of alcohol products, which we have been raising now during the presidency very strongly, be it taxation, they're all European-wide decisions. And this is something where we really need to work together. And yes, one can say that this is one of the most difficult topics of European policy, precisely because different countries have different amounts of national business interest linked to that. The trend is clear. The trend is clear. The alcohol duties are rising all across Europe in different pace, yes, but the trend is very clear. The science is crystal clear. There's absolutely no doubt about what actually works in terms of alcohol policy. And we just need to do it. But again, just looking at the European Commission, let them do this and that, is of course not the solution. And this is why in Estonia we haven't been just sitting back and waiting for Europe to solve our problems. Every state has to solve their own problems first. But on some issues like labeling, advertising, and most importantly, minimum excise duties, of course the European solution is necessary.
And from the European
Yes, from
level.
European level, let me start from excise duties. And you know, excise duties directive is in our hands. But the rule is that you need to have unanimity at council level, at ECFIN council level. It means all ministers of finance can agree to raise minimum level of excise duties. And Commission fails 2 times proposing raised duties, excise duties on alcohol, and 2 times it was rejected. Only 1 time was successful in 1992, when you have 12 countries, and that's after, till those days, minimum excise duties are still from 1992. It's strange. It means that we need to discuss issues. Maybe we can come from unanimity to qualified majority in public health concerns, because health is a big issue. And we have no instruments, because it is crystal clear. It's not in the hands of Health Council. It's in the hands of ECFIN Council. Second, speaking about possibilities to regulate online sale. It is, now we have a good opportunity to address issues related to audiovisual service directive, where we introduced a lot of proposals to regulate, to banning advertising through using, internet, because it's a pan-European issue. And we will see how things will happen, because it's in Estonian time to presidency to achieve final result, because European Parliament and Council they have a little bit different approaches. But it will be very important to fight to stop to advertising issues. And the third issue is very labeling. We proposed a report on labeling, and I know that we are just waiting. From industry side to address issues, because our message is clear. If you are not ready to present your own proposal or have pan-European labeling of calories and content, then we will start with our legislative proposal. But if I may, Commission proposal was the same more than 7 years ago, and European Parliament rejected this proposal.
So this is a very, very difficult
it's
field.
Lobby. It's very difficult lobby. And speaking of alcohol strategy,
so it's a very, very difficult field, and many questions. We're just
I
running
think
out of
it is
time.
very important to understand. We have in our hands alcohol strategy. This is valid. It's absolutely valid. And we propose a lot of instruments to do, and I welcome Estonians' government efforts to really move forward. But we need to encourage Latvia, Lithuania, because regional excise duties, it's a regional issue. People are buying, people have not chance to go 1,000 kilometers to buy alcohol. No, they're going cross-border. It means that, sorry friends, public health concerns are the same in Latvia, Lithuania, Estonia, and Finland, and in Poland. They are the same. It's absolutely, it's time to understand it and time to cooperate. Because lack of public health initiatives at EU level cooperating between member states cost a lot of people's lives.
Thank you very much for this interesting discussion. We started with e-health, ended with different issues, but they all related, and it's not easy to find consensus among 28 states to soon 27 states.
But Estonian
But we are
presidency
trying.
is a very, very good one, and I count on Estonia, and I wish.
Thank you, Commissioner Andriukaitis and Minister Ossinovski. Thank you.